I told you that on the 14th of June, the National Blood Service is joining the world to mark the World Blood Donor Day. It's important that we have this conversation because what we already do know, that has been told us by the professionals, is indicating that we're not donating blood. We're just deciding not to volunteer. Why? We decided to have the head for blood donor recruitment unit at the National Blood Service right here, David Ahiajo. And Mr. Ahiajo, thank you for joining me.
It's a pleasure.
And we're here because we have a critical issue. Yeah. Do we? Even though we still have to join the world, what do we need to do in the first place before we come to what the World Blood Donor Day in the first place is? What has been the situation? Can you tell us?
Well, thank you very much. Like you rightly said, June 14th, Sunday, is a World Blood Donor Day. And the WHO enjoins its members to observe that day. And it's all about getting blood to save lives. You know, when patients who require blood for their management don't have access to that blood, it results in death. And these deaths are avoidable. So there's the need for us to actually educate and let people know and see the importance of donating blood voluntarily to make sure that we get the blood to save lives. Currently, our situation is nothing to write home about in the sense that we are not donating blood voluntarily at all. And worst of all, with the advent of COVID-19, the situation is worse. So wow. That's our situation.
But why would we need to have these constant donations? Who need donated blood?
Well, thank you very much. In fact, blood needs to be supplied constantly because, one, it cannot be manufactured artificially. It cannot be sold in any market. It takes an individual to donate this blood to save a life. But one difficult thing about blood, too, is that it has a relatively short shelf life. If it's donated within 35 days, it should be used. So if it's not there, then definitely we are in trouble. So the clarion call is that voluntary blood donors should make it a point to at least donate once every 4 months. And if you have people in their numbers donating every 4 months, then we are sure that we have these numbers to save lives. And patients, a lot of patients actually require blood. We have people who have lost blood as a result of maybe motor road traffic crashes, which is a sudden blood loss. And then we have people for whose medical condition is such that the body cannot actually manufacture the needed blood. And some is also such that we have some medical conditions that decreases the blood in their system. And we have some other procedures that require that blood must be made available before the medicine can actually perform those procedures. So blood is very vital.
Now, I've had experiences in which patients have had to bring in their families to donate blood, and constantly that's the situation. Is that not enough?
Well, it's far from enough in the sense that because of the fact that we are not having people volunteering to donate blood, we need to fall on relatives of patients who have received blood to donate to save or to donate to replenish what was given. And that is a far cry from what we seek to do, because one, we are looking at readily availability of the blood, we are looking at the safety of the blood, and most of the times the relatives of patients will not even be there for you to get the blood to save someone else. So the mantra is that at least we should go 100% voluntary, for which we're supposed to be achieving that this year, because there was a declaration that we call the Melbourne Declaration in 2009 by World Health Organization member states, about 14 of them, that declared that by 2020, all member countries should be having 100% voluntary donation. But as we speak currently, we are doing below 45% voluntary. Yeah.
Now, if people have to continue to donate, apart from these interactions you're having with me right here on TV, what else do you do to increase participation?
Well, apart from the interaction, what we normally do is that we also engage the public through education, and for which I must say that we need to do more, because like education has not gone down well with everybody. So we need everybody on board to actually do education. And then aside of that too, we also have a database where we fall on our donors to call them to book an appointment to do a donation. And then we have designated blood collection points scattered across the country where people can go from Monday to Friday and then even Saturdays to do voluntary donations. So we are doing a lot to make sure that people actually understand blood donation and come into donate.
Blood is not for sale. So how ultimately do we hope that we can do the replenishment in the first place?
Well, blood is not for sale, you are rightly so. And the fact that it's not for sale then must come from you and I to volunteer to do donation to actually save someone. But that is not to also say that we don't incur cost in getting the blood or making the blood safe for donors. So there's a cost that goes with blood that we call processing fee. So when you want to access blood, you call at the blood center, you are made to pay a processing fee.
Yeah. Okay, so that's how you access the blood itself.
Yes, accessing the blood, you know, it depends on the condition. The clinicians actually will request that you procure blood, and you'll be given a form, and then a sample will be taken to the blood center. So any blood center, provided blood is available, anybody can go and access blood there, provided the condition demands that.
And the day, June 14, that's the main day. What are you doing to make sure you participate as part of what the normal?
Yes, June 14. So we are having a commemorative event at the National Blood Service headquarters. It's going to be virtual because of the COVID-19, and we are going to stream it live on Facebook. So we have a Facebook link. If you indulge me, I can share the Facebook link. People can actually join in. It's http /m.facebook/ National Blood Service Ghana / when you type that link, it will send you to the Facebook live. So Sunday we are having a commemorative event. We are going to have the Deputy Minister of Health, Madam Tina Mensah, will be in attendance. WHO rep will also be there, and then our CEO will also be there. Speeches will be read out, and we'll like everybody to actually join in and participate so that together we'll have a World Blood Donor Day. Then aside of that, we've also designed some branded nose masks to actually be given to our donors from June 14 onwards. Whoever comes to do a donation nationwide will be given a nose mask, just to also make sure that they are safeguarded so far as COVID-19 is concerned. Yeah.
Well, David Ehiadro is the one who leads the unit that makes sure that all these things are adequately also put in place alongside the other units they have at the National Blood Service. But make sure that you watch the live streaming of World Blood Day. That's the World Blood Donor Day 2020. It's a virtual commemoration event this Sunday from the premises of the headquarters, the National Blood Service, Kolebu Teaching Hospital. And then also join them through the link, Facebook/National Blood, and get interactive within the period. You can also call them on all their main center lines, 0277 50 1010 once again, and they have a toll-free number, very important. Toll-free means you're not charged, 0800 50 10 10. But if you have any doubt, you want to get better information, more clarification on how you can donate and get involved, visit their official website, www.mbsghana.org, and that is where you get the best information. Make sure that you go with the theme, save blood, save lives, give blood, and make the world a healthier place. We all need to help each other to make sure that we have a healthy society.